alaikum wa rahmatullahi wa barakatuh. I am Dr. Wasfi Dhahir from University of Basra, College of Nursing. Today we want to speak about the responsibility of nurses regarding pharmacology. So the nurses are responsible for drug administration or preparing or anything related to the drugs and patients. We must know that the medication knowledge and understanding is very important for nurses to avoid error. And so medication knowledge and understanding, we must understand the pharmacological principle for all medications given to each patient. And we must have adequate knowledge about the patients who are receiving these medications. And also we must understand nursing process consideration. We want to speak about it later, and which related to the medication applied to this patient. The second one of responsibility is the intervention that means to take the medication regimen more tolerable for patient to avoid error and to give solving any problem immediately. And third, preparing and administrating medication safely. And fourth, we must maintain acceptable practice and skill competency. And five or fifth, to determine accuracy of medication error orders. And sixth, to prevent medication error and reporting them if they occur. This is very important to report. That means, and then this is we needed to evaluate our work. And seventh, safe guarding and storing medication. Also, this is very important to keep drug work with the benefit, and also we must maintain the expired date of any drug. So self-medication, administration, and medication error reduction. How we redact these errors or these medications error? So in this way, nurses play an essential role because it is the, as I say, nurses are responsible for drug. Even its administration or application or monitoring or writing, all these processes done by the nurses are the essential role in working. So preparing, administration, prescribe, all these must be administered in response to the physician's order in all healthcare settings. Also, this is very important to know or to understand what are the 6 rights and the 3 checks for safe medication or administration. The 6 rights are right patient, right drug, right dose, right route, and right time, and finally right documentation. While the 3 checks are medication information, preparing, and the third one, drug before administration. These 3 checks and 3 right, we must understand it perfectly, and we must follow it in any step of our medication or using drug. So responsibility of nurses after the administration, what are they? First, recording the administration of the drug. We must report, we must record, we must have a documents. And B, to observe and evaluate and record the patient response to the drug, even if it's positive response or negative response. Why? To intervene if required, to correct these errors if they are occur. So, as I said, evaluating and recording the therapeutic or desired response, and observing, recording, and reporting the adverse reaction. As I said, negative or positive effectiveness must be recorded. What are the medication errors and how we deal with errors? So we must prevent events. We must prevent event. Why? Because this event lead to inappropriate medication used for patient harm that have maybe a very fatal mistake if you don't mention or the errors and put a plan to or to intervene to correct the error, because this error may be harmful for patient. So this is the responsibility of nurses. So nurses are ethically and legally responsible to correct administration of a drug. Yes. When medication error may occur, it occurs during prescribing, writing the prescription, receipt, or maybe occur during dispensing, or maybe occur during administration. And so we must monitor the drug in these steps. Type of medication error. What are the type of medication error? The major type of medication error are: first, wrong patient or wrong drug, route, time, dose, or dose form. Yes, if we mistake or don't use or don't give the drug for the right patient, it will be maybe a fatal mistake. So, also omit dose. And third, wrong diluent. And fourth, wrong strength and concentration. All these, what I said here, all these wrong, the source of wrong. Wrong infusion rate, wrong technique, and deteriorated drug error, and wrong duration of a treatment. These are 8 major type of wrong or medication wrong. So keep it in your mind, the 8 wrong, and also don't forget the 6 right and the 3 check. What are the source of medication error? Yes, not just the nurses are responsible for this error. No, the prescriber, the doctor, the physician, the pharmacist, which give you the drug, and also nurses, and also the manufacturers. Maybe this drug made wrong by the manufacturers, and also the patient, consumer, and their families. Yes, also they maybe are source for error, and also the circumstances. This is the thing which we cannot expect it. Yes, this is may lead to error. So causes of medication error among nurses, what are? When one or more of the 6 right and the 3 check of drug administration has not been followed. As I say, we must follow all the time in each step of our work. We must follow the 6 right and the 3 check. Yes. And when have inadequate knowledge about the drug or about the patient receiving drug, we must understand and we must read the information about the drug, and we must assess or make assessment for the patient to avoid the wrong or the errors. And fail to question the medication order when indicated. Yes. Also, we must read the receipt again after the prescriber. If we maybe you find any error in this prescribed drug. And giving medication based on verbal order or phone, also wrong. Don't give it drug to the patient by verbal order or phone orders. And nurses may have a heavy workload. Yes, this is maybe lead to the error because the nurses work maybe very long time and is faced stress. So this is also maybe occur as a medication error caused by the nurses. Responsibilities of nurses regarding medication error. Yes, what shall we do if we have error? First, prevention. And this means protect the patient against the medication error. Because nurses is the last person who checks medication prior the administration. So this is responsibility for the nurses. For example, the prescriber may overlook patient drug interaction or may be unaware of alteration in the patient's state, or may select the correct drug but may order an inappropriate dose of route of administration. The second one is a prevention, intervention. That what shall we do if we have error? This is also a responsibility of the nurses, and they may take their decision immediately. So perform corrective measure immediately and report all error. This is very important to evaluate our working. We must report all the error. So must be reported immediately as soon as our notes, the error. So prevention of medical error. First, to avoid the medical error, we must follow the 6 right and the 3 check as a guideline for safe drug administration, as I said before. This is very important. So concentrate on one task at each time. That means you must put a plan for administration or drug. Yes, you must give it or check it for every patient, the 6 right and the 3 checks for each patient and at each time. And we must seek information about the patient medical diagnosis and condition in relation to the drug administration. This is we will speak it later about the cycle of nurses process. And we must understand the prescribed orders accurately. This is very important. And never give a drug poured or prepared by someone else. You must give the drug that you prepared by yourself, not by other one. And never giving any medication based on verbal order or phone order, as I said before. You must do what we prepare, what you prepare, what you want to do. Yes, not anyone tell you, please do this for the patient in the room number one or number 2. No, you must take your decision and you must care with your work yourself. And also omit or delay drug dose as indicated by the patient's condition. Yes, we must prevent the medication error. Okay? Omit or delay drug doses and indicated by the patient's condition. And finally, learn essential information about each drug to be given. Yes, you must have information about the drug. If it's sedative, antibiotic, purgative, you must have information about the drug that with you to administer it for the patient. So, what we said before, but medication error continue to occur. Why? And some are fatals. These errors sometimes fatal. They kill the patient. So the question, drug administration is a result of multidisciplinary action. That is the responsibility of error, not just related to the nurse's work. So we have multi-disciplining actions. Maybe lead to error, medication error, and that why we said error continue to occur. So there are multiple individual healthcare provider and several steps involved in medication error.